people that work in ERs is that if you're here with COVID, either you are immunocompromised already, and it's like impossible for you to fucking avoid it, and you got it and you're immunocompromised, so you're here, or in the more common case, the infinitely more common case, unvaccinated. That's it. Okay? If you're relatively healthy, if you are vaxxed up, double vaxxed, especially if you're boosted, you get COVID, you take it on a fucking chin, bruv. Doesn't mean that it's still, you know, something you should seek after, obviously. Okay? But still not great. Okay? Still not great, but if you're boosted the fuck up, you're, you know, pretty much GG's. Okay? The reason why I mentioned this is because it's going to be important to the lead up to the CDC decision that we're going to discuss in a second.
The fight against COVID, the U.S. averaging a record-shattering more than 400,000 cases per day now. This as millions of kids are heading back to school this morning. Our Trevor Ault is live at a school here in New York with the latest for us. Trevor, good morning.
Good morning, TJ. This is truly a unprecedented start to the year here with a record-shattering number of new infections, and that is impacting.
3 people are getting COVID every second. 3 new people are getting COVID every second right now. This shit is impossible to avoid, okay? The only certainties of life are no longer just death and taxes. It's also getting the Omicron variant of COVID, okay? Now, I'm not saying this to freak you the fuck out, because a lot of people are freaking the fuck out. How do you address people claiming that the CDC is suppressing data and scientists? What? There is no evidence for that whatsoever, okay? I don't know what the fuck to say to some weird shit like that. I don't think the CDC is suppressing evidence in scientists. Anyway, let's keep going.
Impacting hospitals, it's impacting businesses, and it especially is going to be impacting schools. The education secretary says schools around the country who are hoping to return to the classroom could very easily have 5-10% of their staff out sick with COVID to now start this new year. This morning, the new year is off to an unprecedented start with record-breaking levels of COVID infections across the country. Cases skyrocketing more than 200% in the past 2 weeks. On average, now more than 400,000 reported a day, more than ever before.
We are definitely in the middle of a very severe surge and uptick in cases.
The Omicron variant triggering explosive outbreaks in areas like Puerto Rico. New infections there increasing 4,490%. And hospitalizations, while lagging, are on the rise. Patient numbers in New York mirroring the levels of this time last year.
Are you concerned that the CDC is lowering the quarantine period to appease anti-vaxxers? I don't think they're doing that to appease anti-vaxxers. I think they're doing that to appease big business, as I've stated before. And I do believe that is going on. One of the insanely unacceptable things that the CDC did, other than, you know, straight up reducing the quarantine period from 10 days to 5 without any new additional data available, without even making their data available as to how they arrived at that decision, and then openly admitting that they did it so that society does not collapse and that, you know, businesses will continue to function, was the way that they said it, which was, if you get COVID for 5 days, after 5 days, you can go back to fucking work with no extra qualifiers. Like there wasn't a specific thing where you had to get 2 negative PCR tests. You know what I mean? Now the CDC is going back on that and potentially adding that 2 negative test results before you're able to go back into public after 5 days. I guess restriction, right? But the issue is, it's too fucking late, okay? You already came out of the gate swinging and you said 5 days instead of 10, and you didn't even fucking require negative testing. And as a matter of fact, even went so far as to say you might still be showing positive on tests, but you're probably not as, you're probably not spreading COVID anymore. There are a couple issues here, okay? One, if 100% of the population was already vaxxed up with COVID, okay? If 100% of the population was vaxxed up with the COVID vaccines, right? Then it doesn't matter. Yeah, get COVID, get Omicron, whatever the fuck, you're fine. You're gonna be fine. You're not gonna die. You're not gonna fucking go to the hospital. You're gonna be out for like 2 days, 3 days, right? You're going to be out for 2 days. You're going to feel bad. You're not going to have your taste, but you're going to recover. It's going to be similar to the seasonal flu. As a matter of fact, it's going to be, as I've said before, most likely less deadly than the seasonal flu. However, we don't live in that world. We don't live in a country where there's like a reasonable amount of people that are fucking vaccinated, double vaccinated, boosted up. We don't live in that world, motherfucker. We live on a planet. We live on a continent. We live in a country where homies are straight up like, yeah, no, I'm just not getting vaccinated still. I'm not going to do it. You can't make me do it. You can't make me do it. I will not get vaccinated. So if you're that guy, one, the likelihood that COVID doesn't escape your body or leave your body in the immediate 5 days or 3 days or whatever the recovery period is, obviously increases. Okay. So if you are unvaccinated, you're fucking up the whole game for the rest of us.
XQCL.
Okay. At this stage, if you're unvaccinated, you're not only not protecting yourself, but you're also the reason why we have to implement these fucking rigorous lockdown measures. If we lived in a country where everyone was vaccinated, I would be advocating, first and foremost, like I did originally when the vaccines first came out, as like a full-blown open up the economy, I'm trying to suck on doorknobs type beat. Okay, that's what my advocacy would be in. Be a fucking anti-masker. But because we're not there, because we are never going to get there, unfortunately, we have to take more restrictive measures. Okay? Now, the real fear that I have, even though Antonio Fauci is personally considering not personally, but the CDC is considering implementing 5-day testing measures on top of the lowered quarantine restrictions. I guess improving the quarantine restrictions a little bit by saying you at least have to get tested. But the reason why they didn't do that originally, my fear, my speculation is because there aren't fucking tests. Okay? Because as is the case with every single step of this goddamn pandemic or bandemic, whatever you want to fucking call it, we have consistently fallen short on what is necessary. We just don't have tests. So what are you going to do? You don't have a test. You can't get tested. So what's up? You're not going to get back to work? No, of course. They want you to get the fuck back to work because the ultimate goal is get the fuck back to work. And I believe that's the real reason why they after lowering it to 5 days, they didn't actually fucking qualify that by stating you can only get out in public in 5 days after you tested negative. Okay?
The real bottom line that you want to be concerned about is, are we getting protected by the vaccines from severe disease leading to hospitalization?
Dr. Fauci says the CDC may now update some of its new guidance, potentially recommending people with asymptomatic infections and no fever get a negative test before ending their isolation at 5 days. And there's growing concern for children.
Why is there growing concern for children? Because more children than ever before are showing up in hospitals now. Why are they showing up in hospitals? Because they are the highest unvaccinated population. So because they're the highest unvaccinated population, now the number is still, insignificant in comparison to like who's actually dying from COVID. But given that we do not know the long-term results of getting COVID, the likelihood that you could get long COVID, the likelihood that, it could have debilitating problems down the line, even including like losing IQ points with brain fog and shit like that over the course of COVID, like it has created a situation where kids are also at risk. Okay? Babies are getting fucking COVID. How are you going to deal with that? How do you know what kind of negative consequence that's going to have on your child? Can't believe the kids are anti-vax, people pago. Yeah, no, it's a little fucking dumbass baby who's like, I don't want to get this vaccine. Goo goo gaga, motherfucker.
Last week, the nation reported a 66% increase in children admitted to the hospital because of COVID-like symptoms. This morning, the FDA now authorizing booster shots for 12 to 15-year-olds. But the youngest kids, still fully unvaccinated, are still at risk.
The high fevers came in waves. She just laid on me, basically, for 3 days straight.
Thank you, Hasan.
Sarah Barlow's 2-year-old daughter tested positive and spent 4 days in the hospital.
It can get bad. It's not just a simple cold for everybody.
And now America's schools are weighing whether to reopen. Dozens of colleges are already gearing up to start their semesters online. Atlanta public schools are switching to online-only classes this week. But in New York City, about 1 million students are expected to be back in person with new COVID safety measures.
We lost almost 2 years of education. We can't do it again.
And all that demand for testing.
So we need tests. We need tests. We need to have as many tests as possible so we can figure out who the fuck has COVID. But we don't have enough tests. We need tests to be able to get back to work. We need tests to be able to figure out if we should quarantine. And the CDC's decision reflects that need, reflects that reality. And this 5-day quarantine shit straight up reeks of don't wear masks, okay? Like they did in the beginning of the pandemic. Remember when the CDC said, oh yeah, don't wear a mask. It's not that important. Masks don't actually provide coverage. And then they came out and were like, actually, we had to lie to you about the mask thing because, we needed PPO for, we needed protective gear for our nurses and for our healthcare folks. You know what I mean? Our folks in healthcare. And I feel like we're literally a PPE, sorry. I feel like we're literally doing that right now because there's not enough tests out there. How are you going to fucking rip the rest of the fucking planet? Exhaust all natural resources, exploit and extract all natural resources from the third world, do imperialism, and then you still can't fucking, you still can't offer tests to the American public in a time of need. What's up, dude? How are you not going to do that? How are you not going to be able to do that? Shit's like fucking falling apart. And for the record, there is that negative consequence that we saw of the CDC saying, yeah, you don't have to wear a mask, right? Remember? The conservatives never gave that up. They talked about it non-fucking stop. As a matter of fact, they talk about it to this day. Remember when Dr. Anthony Fauci said, don't wear a mask? And then they wanted you to wear a mask? Well, why would I wear a mask if they can't even figure it out? Ben Shapiro, who is, of course, a misinformation agent himself, had this to say about the CDC's decision. Where is it? Oh, here it is. Here, this is what I was going to say. So yesterday, Ben Shapiro tweeted this out. When the U.S. is considering adding a negative test to its 5-day isolation guidance for people with asymptomatic COVID-19, the White House's top medical advisor says, Dr. Anthony Fauci says, the CDC got significant pushback on its recommendation last week. I was fucking right. Everyone else, once again, that shit on me for fucking negative engagement farming was completely fucking wrong. Suck my dick, everybody else, okay? Here it is. Here's a one fuck you, and here's another fuck you. Suck it, okay? Double suck me. Suck me from the front and also from the back. Now, that's unimportant, obviously, in the grand scheme of things. What's actually important with respect to this fucking story is that obviously this kind of change, obviously this kind of change in the CDC's rhetoric when their main goal is to set these guidelines and communicate them effectively, is that this kind of misinformation will be utilized by people like Ben Shapiro to further cause chaos and to further undermine its credibility. And that's precisely what he's doing here. Amazing how quickly the science changes. Miraculous how fast new data pours in. No wonder only the experts, trademark, can understand it. Probably it's totally apolitical and has nothing to do with the public pressure from the administration's leftist allies. So what this moron, what this baboon is admitting / also failing to consider is that, yes, there is a level of public pressure that they are influenced by. Okay? It's about who they're getting that pressure from, though. And if this dumbass does not comprehend that, like, the original decision to lower it is pressure from the business owners and those who are titans of commerce, then I don't know what to tell you. That is precisely what is going on here. The original decision, as admitted by Fauci, was to make sure that commerce continues, to make sure that society functions, because there weren't going to be enough pilots, there weren't going to be enough hostesses, there weren't going to be enough waitresses, there weren't going to be enough retail workers during the holiday season. And God forbid that happens in a country like the United States of America. Then, full-blown economic collapse, boys. Because of the way that Omicron was spreading, because of how fast Omicron was spreading. And that's the reason why they went fucking balls to the wall and didn't even include a negative test in their original lowering of the quarantine restrictions. So while Ben Shapiro is technically right in the sense that, yes, some of these decisions are made by outside influences, and it's not necessarily, it's more like a balance. It's a delicate balancing act between what the public's perception is going to be, how much they actually follow the restrictions that are placed by the CDC, and also where the stress is coming from. So if the public is not following the protocols, they're like, well, maybe we should lower them so that they will actually follow the protocols, which is idiotic in my opinion. Okay? Because that's precisely what they said, by the way. This is not my take. This is the CDC's own narrative on this issue. They said they did this because not because there was new data available, there wasn't, but because one, the public was not following 5-day or 10-day quarantine measures anyway, because it was far too long for them. So the public stress is there. And also because Omicron was ripping through the fucking lands. And when Omicron is spreading so rapidly, and if you're vaccinated, it has less likelihood of fucking you over. It's less severe, 50% less hospitalizations, at least according to data coming out of the UK. That it's not necessary to quarantine for as long, especially because if you are asymptomatic and vaccinated, the likelihood that you're going to continue spreading it in the aftermath of 5 days is lower. Okay?
F.
These are uncertain times, but the only certainty is that you're probably going to get fucking COVID if you go outside. You're probably going to get Omicron, but also most likely if you're boosted, if you're vaccinated, if you're double vaxxed, it's not going to be as bad as the prior versions of COVID. The only other certainty similar to that is the top of the hour ad break.
Now, in many instances, slow down the wait for your results. One of the nation's largest testing companies, Quest Diagnostics, tells ABC that their average processing time has gone.
What do you say to people who go, I'm following guidelines, I stay socially distanced and take the consequences for not taking the vaccine, but I won't take the vaccine because I'm not afraid of dying? I don't fucking know, man. Then die. That's what you say. Then die, dumbass. Okay? Then if you get COVID, I'm not going to fucking mourn you. And I'm going to make fun of you, actually, for dying on your own. Like, you wanted to die so bad, and now you're fucking dead. Or worse, you're in the fucking hospital, and you're not dead yet. I'm going to fucking sit there, and I'm going to shoot a TikTok video literally doing the Fortnite L dance over your fucking dying body, okay? As a team of nurses try to, make sure that you don't get bed sores from laying on one side. I'm going to be waiting for that fucking shift change so that I can get the right moment so I can do a fucking, L nerd dance, okay? I'm gonna do a TikTok dance over your fucking dying body. That's what you should tell people. And then they'll fucking cry and they'll be like, oh, what do you mean? That's kind of fucked up. And then, you turn around and you say, okay, well then avoid it, dumbass. Okay? You don't want me to fucking TikTok dance over your dying body at the hospital when you got a fucking vent inside of your throat, okay? Then get the vaccine. It's like there's nothing you can do. You're talking to a brick wall. You're talking to someone who's like, I understand that death is a possibility and I do not care. If you are not afraid of dying, then you should not care that I'm going to make fun of you when you die, okay? It's really simple. Don't fucking die, okay? Vented patients are unconscious. Yes, but while the person you're talking to has the processing power of a vegetable, their brain is supposed to understand that, like, before they get vented, you'll still make fun of them. So right now, I suspect the person you're talking to, having a conversation, is not vented yet, and they're not unconscious yet. So they'll understand that anger and that fear of resentment and that you're emotionally manipulating them into getting the vaccine is basically what I'm saying. Okay? Went golfing with my conservative unvaxxed friend Friday, and he didn't tell me that his girlfriend that he lives with tested positive 3 days prior. We drove together and he didn't wear a mask in the car. I'm beyond pissed, and I don't know if I can keep being his friend, to be honest. Yeah, that shit is really fucked up. I mean, it's like completely unacceptable, dude. That's like
4 months, baby. I'm back.
Fat and old people are it's fat and old people that are dying. You should stop scaremongering. Dude, you are most likely fucking fat. Shut the fuck up, okay? Shut the fuck up. There's like 3 skinny conservatives, and every conservative anti-vaxxer acts like they're literally like 6% body fat, shredded the fuck up. You're fat, okay? You're an American. Automatically, I suspect you probably have comorbidities because of your unhealthy fucking diet, and you're probably fat too on top of that. Shut the fuck up, okay? It's like, it's ridiculous that we are still making these stupid fucking arguments.
Hi, Hassie.
Motherfuckers be like, oh, fat people are dying. I'm like, have you looked around? You live in like Oklahoma, dog. Now, there are obviously systemic issues that we need to conquer to be able to fucking fix America's diets, but that's a long-term solution. That's not easy to fucking deal with right now. So in the short term, before we fix that long-term problem, maybe we should focus on areas where, I don't know, we could save fat and old people from fucking dying. I think that's a good way to go about it. I'm fat. My entire fucking family's fat. I don't want them to die. So we're all unvaccinated. Shut the fuck up.
Love you, chat. Stay healthy.
La la la, no DMCA. La 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 la, no DMCA. La 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 la, no DMCA. No DMCA. La 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 la, no DMCA. La 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 la, no DMCA.